A betrayal of trust, the Tuskegee Syphilis Study. From 1932 to 1972, the U.S. Public Health Service conducted a study on untreated syphilis in Macon County, Alabama. The study involved 600 African American men, 399 with syphilis and 201 without. These men were promised free medical care for bad blood, a term encompassing various ailments. However, they were never told they had syphilis, nor were they given treatment, even when penicillin became available in the 1940s. The participants, impoverished sharecroppers, were lured with promises of free healthcare, meals, and burial insurance. They were subjected to painful and unnecessary procedures such as spinal taps, presented as special free treatment. The researchers deliberately withheld information about the study's true nature, denying the men the right to informed consent. The study's deliberate deception and exploitation of a vulnerable population remain a dark stain on the history of American medicine. The Tuskegee study violated the basic tenets of medical ethics, exploiting a marginalized community for research purposes. This disregard for human dignity and the sanctity of the doctor-patient relationship sparked outrage and led to significant changes in research ethics. The Tuskegee Syphilis Study serves as a stark reminder of the potential for medical research to be twisted into a tool of oppression and abuse. The Tuskegee Syphilis Study was marred by a deliberate and systematic pattern of deception. The researchers, primarily white, intentionally misled the participants about the study's purpose. They used the term bad blood, a local colloquialism, to obscure the true nature of the research. The men were not informed of their syphilis diagnosis, nor were they given the option to refuse participation. The researchers conducted painful and unnecessary procedures like spinal taps, under the guise of free treatment. Even when penicillin became the standard treatment for syphilis in the 1940s, the men were denied access to this life-saving drug. The researchers actively interfered with the men's access to health care. They discouraged participants from seeking treatment elsewhere, even contacting local doctors to prevent the men from receiving penicillin. This deliberate obstruction of treatment ensured that the study continued, but at the cost of the participants' health and lives. The researchers viewed the men as mere subjects, not as individuals deserving of respect and ethical treatment. Their actions exposed the deep-seated racism within the medical establishment and the broader society. The Tuskegee Syphilis Study cannot be divorced from the pervasive racism that permeated American society and its institutions, including medicine. The selection of African American men from Macon County, Alabama, was no accident. The county had one of the highest rates of syphilis in the nation, and the men, mostly impoverished sharecroppers, were deemed a captive population for research. The researchers' racist assumptions shaped their actions and justified their disregard for the participants' well-being. They believed that African American men were less intelligent and more prone to risky sexual behavior, making them suitable subjects for a study on a sexually transmitted disease. The Tuskegee study took place during the Jim Crow era, a period of legalized segregation and widespread discrimination against African Americans. It exposed the deep-seated racism that shaped medical practice and research, and it fueled a legacy of mistrust towards the medical establishment within the African American community. Despite the veil of secrecy surrounding the Tuskegee Syphilis Study, concerns about its ethicality surfaced over the years. In the 1960s, Peter Buxton, a venereal disease investigator for the U.S. Public Health Service, learned about the study and raised ethical objections. He alerted his superiors, but his concerns were dismissed. Buxton persisted in his efforts to expose the truth. He shared his concerns with reporters, and in 1972, Gene Heller of the Associated Press broke the story. Heller's expose revealed the study's horrific details to the public, sparking national outrage and condemnation. The NAACP filed a class action lawsuit on behalf of the study participants and their families, which resulted in a $10 million settlement. The Tuskegee Syphilis Study became a symbol of medical racism and research abuse. The Tuskegee Syphilis Study cast a long shadow over the relationship between the African American community and the medical establishment. The study's legacy of mistrust continues to affect healthcare access and health outcomes for African Americans today. This mistrust has manifested in lower rates of participation in clinical trials, reluctance to seek medical care, and skepticism towards public health initiatives. The study's revelations sparked a national conversation about research ethics and the need to protect the rights and well-being of all research participants. The Tuskegee Syphilis Study serves as a stark reminder of the lasting damage that medical abuse can inflict on individuals, communities, and the very fabric of trust that underpins the doctor-patient relationship. Addressing this legacy of mistrust requires promoting diversity and inclusion within the medical profession, and ensuring that ethical considerations are paramount in all aspects of healthcare and research. The Tuskegee Syphilis Study stands as a pivotal moment in the history of medical ethics. The study's horrific revelations sparked widespread condemnation and led to significant reforms in the way research is conducted. In the aftermath of Tuskegee, the U.S. government established stricter guidelines for research involving human subjects. The National Research Act of 1974 created the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research. The Commission's work led to the Belmont Report, a landmark document that outlines the ethical principles of respect for persons, beneficence, and justice in research. The Tuskegee Syphilis Study serves as a constant reminder of the importance of ethical considerations in all aspects of healthcare and research. Thanks for tuning in, Weirdsville dwellers. Brace yourselves for more bizarre tales every Wednesday at 3 p.m. EST. If you haven't joined our community yet, hit that subscribe button to stay in the loop with the weirdest happenings in Weirdsville. Until our next rendezvous, never stop questioning the unknown and keep that curiosity of yours burning bright. Farewell for now.